trillions of dollars over the next several years. Joining me now to discuss the bill and what steps are to come next are Valley Congressman Jim Costa. Thanks so much for being with us on Sunday Morning Matters. We really appreciate it.
Well, thank you. I always enjoy being here because Sunday morning does matter.
I agree with you wholeheartedly. So you voted against the bill. What are the major sticking points that made you ultimately say no, for you at least?
Well, a combination of factors. First of all, it's big, but I wouldn't use the adjective beautiful. It impacts so many people in my congressional district and their Medicaid and the Affordable Health Care Act, potentially over 460,000 constituents of mine, 1.8 million people in the 5 congressional districts in the Valley. The health care facilities, our hospitals, our clinics, Community Medical Center, Kauai Hospital, Adventist Healthcare, to mention but a few, and between $4 and $5 trillion in additional debt. I mean, we need to work on our debt. It's a real problem. I don't know if many of the viewers understand, but we are now paying more interest on our debt than we pay annually for the budget for the Department of Defense or for Social Security. And 25% of the existing debt occurred during President Trump's first administration. This would add to that by another $4 to $5 trillion. Democrats and Republicans have to work together to get our fiscal house in order, and this doesn't do that.
You started that answer by answering what was going to be my next question, and that being the local impacts. Is there any other impacts locally that would come from this that you want to add?
Well, I think it's important when I look at my constituents. We estimate 133,000 children under the ages of 19 years of age. Their health care would be impacted. Over 22,000 seniors over 65 years of age. We have our health care facilities, our hospitals. It could impact Adventist Healthcare. They estimated by over $300 million for the 3 hospitals they have here in the Valley, Selma, Reedley, and Hanford, and their clinics. And 61% of the patients that Community Medical Center in Fresno provides health care for comes from Medicaid as their safety net. So this could have, I think, a real harmful and perhaps devastating impact on health care across the country.
When it comes to SNAP in your constituents and the usage of that, can you get into that?
Yeah, it's a dichotomy. We're the most productive agricultural district in the country, perhaps, but yet almost 28 to 29% of my constituents are food insecure. And it's a real challenge because it's just not my district, my neighboring district with my colleague. Nearly 42 million Americans rely on SNAP for food support. These are working poor. These are elderly, people with disabilities, children. For every one person in America that receives SNAP, it just generates over $1.50. For every dollar spent on SNAP, it generates over $1.50 in revenue. I'm talking about groceries that are bought, meals that are skipped, and it pushes families deeper in poverty. So it's estimated 18 million school lunch and breakfast programs could be impacted. Fresno Unified, third largest school district in California, produces about 57,000 lunches a day for 85 school sites and over 17,000 breakfasts. For many of these kids, that's the best meal they get during the day.
Let's talk about the money involved in this. Many lawmakers who voted for this bill said they want to reduce government spending, yet if this goes through, that would in a lot of ways create the opposite. So why do you think some of the Republican colleagues voted for it anyway?
Well, I think there's a lot of pressure by the administration, by the president, but it's $680 billion in Medicaid cuts. It's $300 billion in cuts to SNAP. So you add that together, and that's really over $1 trillion in cuts. and that's to extend these tax cuts to the wealthiest Americans. But you could make a logical argument if it structurally reduced the deficit, but it increases the deficit $4 to $5 trillion. That doesn't make any sense. I mean, even Elon Musk in recent days said that this is big and it adds to the debt. And obviously, I think anybody that looks at it realistically understands that.
And still ahead.